Shoulder injuries in cricket, should we anticipate a rise? So upper limb injuries up to about 20 years ago only comprised of 16.8% of all cricket injuries in most of the studies, those out of Australia, England, our own West Indian studies. And shoulder injuries in particular were only about 5.7%. In fact, the incidence reported over the last 20 years has actually dropped. So shoulder injuries has dropped out of the top 5 injury types. And though majority take place in the non-dominant, in the dominant shoulder, 60% of them, there's a lot of shoulder injury in the non-dominant shoulder as well. So why are we talking about shoulder injuries? Well, this is one of the reasons. In modern day cricket, the ball is being hit further and harder. People are measuring the distance that you're hitting. So it's prompting batsmen to want to hit harder and harder. And basically a lot more pressure is put on the shoulders in hitting the ball. It's not just that. People are diving at full length, taking out their shoulders. This poor guy dislocated his shoulder. And people are throwing at much harder rates than before. I recall way back in 1983, there was a test match in Jamaica. West Indies needed 146 runs to win in 2 sessions. The Indians figured that there's no chance they'd have gotten it. Balls were going just to the foot of Kapil Dev. He wouldn't even bend down to pick it up because we had runs to play and so on. Of course, West Indies won the match. That's a different thing. But the point is, every run now counts and people are throwing themselves all over. And so it is my belief that the modern game has changed. There's a lot more limited overs being played. What I mean by that is gone from T20, well, from T50, 50 over cricket, to T20 to T10, and a lot more intensity in fielding and throwing is taking place. Batsmen are diving into the crease. People are measuring the distance that the 6 is being hit, and therefore people are obliged or feel obliged to hit it further and further. And I'm not really worried about those balls that the batsmen actually connect, because when you connect, you actually get a good feel. I'm worried about the ones they miss, because then it's a free swing, and you're likely to damage the shoulder even more at that point. And even spin bowlers are bowling flatter and faster, and therefore putting a lot more pressure on their shoulder. So if you look at this sort of effort here at the boundary, which didn't result in an injury, but just look at the effort. This guy's going down, all force on his shoulder, kicks the ball, decides that he's going to stop it from going to the boundary by flipping over and landing on the other shoulder. So a lot more force on the shoulder that didn't exist maybe 10 years ago. I'm going to give a very, very brief outline on what these injuries are, because basically there are 2 major types, instability and impingement. Instability meaning either frank dislocations or subluxations, partial dislocations and instability that takes place over time, as opposed to the impingement injuries, which are subacromial bursitis, rotator cuff attenuation, and internal impingement. And I'll just briefly describe them very quickly. So instability can be from trauma of hitting the ground, like you see Shane Warne here, who went across and held onto his shoulder, went on to get surgery for this because what he had was a frank, well, more than a subluxation. I think he actually went out and back in again. Consistent microtrauma of bowling contributes to instability. And you'll have, it's been noticed that shoulders that have more deficits in internal rotation, both in fast and spin bowlers, are likely to go on to get shoulder injuries. So if you have less than or a difference of 10 to 20 degrees between your dominant shoulder and your non-dominant shoulder, there's a chance that you're likely to get a shoulder injury. The other thing of interest is that if you had a shoulder injury in one season, which led to a non-time loss injury, there's a likelihood that you're going to get a time loss injury the following season. So you've got to pay attention to that, and you've got to rehab and make sure, or prehab rather, to make sure that that injury doesn't exist. So inevitably, what happens with these labral injuries, that you get a labral tear, very much like what you're seeing here. And this was a cricketer that we had to go and fix. And so a bit of knot tying and so on. And what you end up with is a nice bumper that has restored the labrum, and then a lot of rehab that brings them back. So that's the hard way to do it. Or you can do the easy way. And if you watch Rohit Sharma here, went out and boom, there goes the shoulder, put it back in. But unfortunately, not everybody can do that. Impingement, on the other hand, takes place with overhead throwing, which leads to external impingement. I don't have the time to sort of go through what the biomechanics is, but the truth is that with more throws taking place at harder velocities, it's going to hurt the shoulder even more. So one of the reasons why the West Indian fast bowlers lasted so long was that when they fielded at the boundary, they'd actually bowl in the ball as opposed to throwing it in, because that's the action that would injure the shoulder. So Courtney Walsh, for example, extended his playing career, I'd say, by 3 years just by adopting that policy. When you are bowling itself, the humeral head is impinging on the labrum and the biceps anchor, leading to internal impingement that can go into slap injuries, that can go into microtrauma of the labrum. And heavy hitting, as I said, the end swing impingement that takes place when you really get a good hit can also cause internal impingement as well. But the other message I want to give you in the last 4 minutes is that there are other conditions you've got to consider. There's your acromioclavicular joint, which is very often damaged and people completely miss it, and scapular disorders, which is part of the shoulder complex. And I'll leave you with just one case study which sort of exemplifies how you shouldn't miss things. We had one of our players who's actually playing in the IPL years ago, picked up a ball and threw it from the boundary and had immediate pain in the shoulder. Missed the game, was seen by the medical staff. They figured there might have been something wrong with the rotator cuff, did an MRI. That MRI was normal. So he underwent rehab and was sent back home, had a lot of rest and rehab there, and then the pain went away. So he decided he's going to continue playing, he was going to return to play. Did so, and in his first match, he threw the ball and felt catastrophic pain in that area again. So once again, an MRI was done, and that MRI came out to be normal. And in fact, we were touring India at that time. So the guys had to leave very early and we had to make a decision. Are we going to risk there's a month for the tour. So are we going to rehab him and take him on tour, or are we going to pull him back? And we decided, let's rehab him because he was one of our key players. But then when we did the repeat MRI here, at the periphery, we noticed that there was something going on and the doctor ordered a CT. And lo and behold, there was this separation of the coracoid. So the guy actually had a coracoid avulsion fracture, which simply needed a screw to fix. And he, at the end of that, is back to playing right now. He's back in international cricket and so on. But the point, it was completely missed across many continents simply because nobody paid attention to what had happened to him. And we're relying on the MRI, which didn't show that part of the bone. So just a little word to the wise that beware that there are other conditions that you've got to look out for. It's not all about impingement and instability. So I put this forward because I do anticipate a rise in the future of shoulder injuries due to the reasons I showed you. And therefore, to have shoulder prehab programs, shoulder strengthening exercises, proper rotator cuff exercises, and so on, is probably something that should be built into a pre-season fitness program rather than waiting for that shoulder injury to take place. Throwing techniques are more important than now. We had employed a throwing coach long ago, and interestingly, baseball seems to have the best throwing techniques, and their coaches are the ones that come across and give those lessons. But the submarine throw, where you can do it as opposed to the jerking overhead throw, limiting the amount of throws in practice and so on, are all things that perhaps have to be put into practice because, as I said, I anticipate that when we meet at the next Congress or the one after that, you're going to see big papers on shoulder injuries. Thank you very much.